Okay, guys, we're going to push on now with the second part of this, which is we've done basic life support, but about the use of defibrillators. And truthfully, this is a very important part of medicine now. The use of defibrillators in resuscitation is essentially mandatory. And obviously these are pieces of equipment that many of you will have access to. So the provision of an AED, an automated external defibrillator, in a life support situation. 50% of all deaths due to cardiac arrest in the UK could have been saved if an AED had been available. That's an amazing statistic. And when you apply this to the following one, early defibrillation can increase the chance of survival from 5% to more than 50%. You can understand why. What this essentially means is that without defibrillation, 95% of cardiac arrest patients will die. But with defibrillation as part of your suite of treatments, you can reduce that to only 50%. Only. It's now the truth is, if this was a drug, it'd be the drug of the century, because an increased mortality or a reduction in mortality rate by 45% is unbelievable. Which is why the rollout of the AED program throughout the world, in all developed parts of the world, has been truly amazing. And we know this because 75% of pre-hospital cardiac arrests will respond to defibrillation. The picture you can see on the screen at the moment, I took in Waterloo Station, and I counted how many defibrillators I walked past from one train line to another. I walked from platform 19 on the main line down to the Jubilee line, and in that 5-6 minute journey, I walked past 6 AEDs. Now, when you consider the amount of people that pass through that station on football, that's just about right, because high travel areas, there is a risk that people will have cardiac arrest. We know when people gather, some people will die. People die. It's so having public access defibrillators is a very, very good idea. Now, the truth is, these type of cabinets that you've got, the minute you open it, it immediately summons somebody who's at least first aid or work trained. And these devices also come with an airway bag, a little Goodell airway, a lateral mask, and maybe a little suction device as well. So it's a comprehensive little piece of equipment. So 75% of pre-hospital cardiac arrest will respond to defibrillation. Great. We gave this statistic before. The other 25% is the H's and T's. Trauma-related cardiac arrest are generally non-shockable rhythms. I'll explain why in the next session, actually, because they have a tendency to have non-perfusable types of cardiac arrest. Now, the chances of successful resuscitation reduced by 5 to 10% each minute the person is not successfully defibrillated. Now, this little chart is what underpins all resuscitation, okay? I told you Fabrice Muamba was successfully resuscitated. Well, he was resuscitated within 4 minutes, and we can see with that chart, in 4 minutes, you have a 70% chance of survival. But if he'd been left for 10 minutes, he would have certainly died. So speed of resuscitation is one of the most important aspects. And this comes down to the amount of metabolically available oxygen that the patient has. So early defibrillation means that you are defibrillating back tissue that it has not started to necrose or die. Now, obviously, there's a couple of things that can influence this. If you simply choose to give the patient resuscitation, obviously that oxygenates the tissue until they can be defibrillated. But there's other things that can affect it, really. And certainly diving has a couple of elements there. When you go diving, if you're diving from a bell, then bare minimum you're being exposed to 600 to 800 millibars of oxygen, whereas normal atmospheric levels are only 210 millibars. So that means that instead of lasting 5-10 minutes, maybe your tissue will last, you know, 20-30 minutes because you've got more metabolically available oxygen. So the amount of available metabolic oxygen is a key issue. Okay, cold is a key thing. Okay, cold is double-edged. It can kill, but it can also preserve. And the next video you're going to see is a great example of this. You're about to watch somebody who actually died from freezing to death in a snowdrift and was successfully resuscitated 6 hours post-mortem. Notice in the video he's only lost a couple of fingers. 20-30 minutes because you've got more metabolically available oxygen. So the amount of available metabolic oxygen is a key issue. What you're going to see is a cold from freezing to death in a snowdrift and was successfully resuscitated 6 hours post-mortem. Notice in the video he's only lost a couple of fingers.
I started shaking his head. No, you can't leave me. You can't leave me.
All signs lead us to believe that he's been dead for a considerable amount of time.
ECMO, extracorporeal membrane oxygenation.
No, I've never even heard anything like this. It's amazing. It's something I've never heard of, and I can't thank everyone enough.
Okay, so hyperbaric oxygen and hypothermia can be your friend here. Okay, so and it's important to be aware of this. Essentially, in resuscitation medicine, you're not dead until you're warm and dead. If somebody comes in with hypothermia, we will resuscitate them as we raise their body temperature. So AEDs, automated external defibrillators, they are designed for lay rescuers to successfully deliver defibrillation. They're safe, effective, lightweight, durable, low maintenance, and easy to use. Truthfully, I've never seen anybody unable to use it because they all use the same very simple operating system. Okay, I once got my 6-year-old daughter with a mannequin to see if she could operate it. She managed to operate it perfectly because it really is such simplistic operating system, which is essentially switch on, analyze, zap. Okay, the AED interprets the heart rhythm and determines if a shock is required. The unit prompts the rescuers to deliver the shock if necessary. And more importantly, the AED will not shock somebody who does not need a defibrillation. Okay, once you've switched this on, essentially the algorithm is in charge. You're not in charge.
A healthy heart pumps regularly at various levels of exertion and coinciding heart rates. Cardiac arrest occurs when the heart stops pumping correctly. Chaotic electrical activity throughout the heart causes uncontrollable fluttering or ventricular fibrillation. The heart beats erratically, no longer pumping oxygen-rich blood around the body, which starts to shut down. Automated external defibrillators are designed to shock the heart back into its normal rhythm. Placing 2 monitoring electrodes on the chest, the AED measures the electrical activity of the heart, analyzes the cardiac rhythm, and determines whether a shock should be administered.
Okay, so completely automated. Okay, principles of safe AED use. Make sure the victim bystanders are safe. Maintain adequate CPR and minimizing breaks. This is one of the great problems with the use of defibrillators is that the minute that nice fancy equipment has got there, people forget the basics. there's only 2 moments when basic life support or CPR should not be taking place. That they are when the AED is analysing and when it is zapping, okay? At every other point, CPR should be taking place. As soon as the AED arrives, follow the voice and visual prompt, switch it on. Some will automatically switch on just by opening the lid. Attach the pad as instructed. Ensure nobody touches the victim while the AED is analysing. This isn't in case somebody gets accidentally shocked. This is because if you physically contact the victim, the AED is now trying to analyse your cardiac rhythm and the patient's, okay? So you must not touch the patient when it's trying to analyse. If a shock is indicated, ensure that nobody touches the victim. You need to verbally say, everybody away, oxygen away, and then push the shock button as indicated. It'll have a bright red or orange flashing light on it, okay? And, you know, and then defibrillate. Okay, this algorithm is the AED algorithm. And actually, it may look complicated, but when you look at the first 3 bars of it, it is just a basic life support algorithm, okay? Unresponsive, non-breathing patients, go and send for the AED, give good quality CPR until, with supplementary oxygen until the AED is attached. Once it's attached, you're essentially not in charge, okay? You're then going to assess the patient's rhythm. Okay, so and obviously the machine is doing that. It's looking for 2 types of shockable rhythms: ventricular fibrillation or ventricular tachycardia. You don't need to do that. That's what the algorithm's for. Okay, if a shock is advised, so with an MVT or VF, it's going to advise you to shock. You're going to shock, and then you're going to resume CPR for 2 minutes. The AED will record this time. You don't need to do anything or other than give CPR. After 2 minutes, you're going to reassess the rhythm and the decision tree once again: shock or no shock. If it's no shock, you will be sustained for 2 minutes and then reassess. This algorithm continues until the victim wakes up, they move, open their eyes normally. Okay, the truth is, guys, you are doing advanced medicine when you're using equipment like this. And as a DMT, you're going to use many skills, cannulation and things like that, which pushes you over to the advanced style of medicine. And one of the most important aspects of this is good leadership. And this is going to become a more important aspect of the course as we go on. The video you're about to show is and many aspects of the video now are real. So you're going to see a real cardiac arrest situation, but you'll notice it's cool, calm, and collected. So what you're about to see is the advanced life support approach to resuscitation, okay?
Bernard, are you all right? Can I have some help, please? Can you put out a 2222 call, ask for the adult resuscitation team, and bring back the resuscitation trolley? You can take over CPR for me. I'm going to count you in.
Okay.
Are you ready?
Yeah.
Okay. 5, 4, 3, 2, 1. We carry him with 32 on the bag valve mask with the oxygen on. I'm going to attach the defib pad to carry on that CPR. In a minute, I'm just going to ask you to pause and have a look at the rhythm. Okay, just pause CPR. That's a shockable rhythm. Carry on CPR again. I'm going to charge the defibrillator. Can we take the oxygen away? Clear. Clear. Carry on with that CPR. Clear. Clear. Okay, staying clear. Shock it now. Carry on CPR. I'm just going to move the bed. Keep going with those chest compressions. Okay, that's the bed sorted.
Bill, my name's Mandy.
Oh,
I'm the
hello,
resuscitation team leader. What's happening?
Hello, this is Bernard. He was admitted here with chest pain and he's found collapsed. He was in cardiac arrest. We've given him one shock with the defib.
So we're about a minute in.
We're about a minute in, yeah.
Okay, thank you. Right, so we've got good quality chest compressions going off 30 to 2. Isabella, our anaesthetist joined us. Can you please take over the airway management, please? Thank you. And we've got Keith. Excellent. Defibrillation. Keith, we're about a minute in. If you can just check the timings for me, please. He's had one shock already. Bill, can you get me the patient's notes, please?
20 seconds until the next 2 minutes.
20 seconds till we're coming in. So at that point, Amita, I'd like you and Yanni to swap over within the rhythm check, okay? So we're going to swap over at that point.
So highly organised, okay? And guys, when you're doing the practical aspects of the course, this standard is what we're going to aim for, okay? And almost always we achieve it in our courses. Being a DMT, okay, leadership is an incredibly important aspect of it. I realised that video looks like it was set up as a scenario, but what you'd actually witnessed there was a real life cardiac arrest, okay? And, you know, the most key thing there is to keep it cool, calm and collected. Right, going to stop it there now. Please feel free to carry on with answering the MCQ questions to complete this session. Okay, okay, thanks for watching.